Hi, everyone. Welcome. I'm Angela Love-Zaranka, Program Director for Lactation Education Resources.
And hello, I am Sekeita Lewis-Johnson, the Accredited Provider Program Director here at LER.
Thanks, everybody, for joining us today. We are going to have a little bit of real talk, the realities of being and becoming an IBCLC. So to help with interactions and participation today, if you'd like to ask questions or make comments, you can take a look at the GoToWebinar platform if you are participating today from your desktop. You can tell by this blue arrow here that this is where you're going to find the question box. And you're welcome to comment as well, either just to say hello or to let us know where you are participating from today. We'd love to hear from you. Now, if you're on a mobile device, take a look at this green arrow. And at the bottom of the GoToWebinar interface, you will see the question mark. And so feel free to click on that and ask any question or make any comment that you would like. Now, joining our webinar today is Wendy, who is from our amazing customer support team. And she's going to be monitoring the questions in the question panel. She's going to answer a few, and then she'll leave a couple for us to answer at the end. Also joining us today is Jill from our amazing tech team, and she can answer any sort of questions that you may have with any tech issues. So let's go ahead and get started with becoming a lactation consultant. Now let's dive into this a little bit and take a closer look at what it means to become a lactation consultant and how you can follow your passion and become one as well. If you become an IBCLC, or when you become an IBCLC, you will join more than 35,000 IBCLCs in 130 countries. Who's who in the IBCLC credential? Well, credentialing as a lactation consultant is offered by the International Board of Certified Lactation Consultant Commission. Take a look at their website, ibclc-commission.org. They have different regional offices depending where in the world you reside or work. Review the requirements and the pathways to become eligible to take the IBCLC exam on this website. Now, some people will ask right from the beginning, well, what do I need to know? IBLCE has a detailed content outline. It's also known as the exam blueprint. It's based on the surveys of IBCLCs in a variety of practice settings around the globe. The outline covers all of the topic areas and the chronological stages of an IBCLC and what they need to know in their work. LER courses cover the entire detailed content outline, and our courses are approved by LARC. That's the organization that evaluates and approves Lactation Consultant Training Program, and it stands for the Lactation Education Accreditation and Approval Review Committee. Now, Sekeita is going to review a few questions you can ask yourself today, but first, I realized that I forgot to introduce ourselves and why. What sort of credentials do we have? What sort of backgrounds do we have in order to present this information to you? Sekeita, do you want to go first?
Of course, Angela, thank you. So my background started as a registered nurse in maternal child about 25 years ago. Been working in maternal child ever since. I am also a board certified lactation consultant. I have also been an instructor, a nursing instructor, and for private practice, I still see clients. And so I have experience working in the hospital as a lactation consultant, as well as in the community setting. Angela, how about you?
So I too have worked in a hospital setting. I've also worked in the community. I started out being a peer support counselor, and so did that for many years and then became board certified as a lactation consultant myself. I too have worked in the community, worked in private practice, educated people for over 20 years to be a lactation consultant. And now I am the program director here at LER. Very excited to be with you today and to sort of share and to give you a little bit of how Sekeita and I both, even though we have, similar backgrounds, but there's still a lot of differences. And so between the two of us, I think we've got quite a bit of a landscape covered. And so, Sekeita, what are those questions that people need to ask themselves as they kick off this journey?
Yes, thank you, Angela. So, as we are talking today, we are hoping to bring the realness to not just all the task and checkbox you need to get your clinical hours, the different pathways, but there are a host of other skills that we're going to talk about today, because we really want to talk about what are the true realities. And I'm going to preface this as I remember when I decided to become a nurse, and it was like, I wish I would have had the realities of becoming a registered nurse. That's a whole nother topic, but there are some things built into this presentation that I think are the foundation and the forework of the skills that are necessary. So some of the questions you do want to ask yourself today is, do I have these skills? Right? Do I have the skills, all the skills? And if not, where am I going to get these skills, right? So I'm not talking about, yeah, you need to have all these skills right now. No, but these are things that you need to put down on the list as skills to be cognizant of, because it makes you a more well-rounded lactation consultant. So let's go ahead and dive in. One of the things I always say is, you may need to write these questions down. It might be helpful because these are questions that are reflective, and they're going to be, the answers to these questions are going to be individual for each and every one of you. And so let's begin by talking about some of the skills that I am alluding to. All right, competency. The first thing, the very, 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 very first, before you even think you want to really say, yes, I am about to sit for this exam, because there's a whole host of things that need to happen. And Angela will talk about that in just a little bit. But are you competent? And that means basically you have the knowledge, the skills, as well as the attitude to successfully complete a task. Now, I recognize that the nuances of individual life, individual circumstances, but the point is do you have the skills to be a novice? Like, are you at the point where you recognize that I still have some learning to do? However, I am competent to see this family regarding their issues. And so really taking into consideration, how do you get how is competency achieved, right? It is achieved through getting the experience, getting the hours, not shying away from difficult consults or difficult situations. It is really mastering, what it means to do a comprehensive lactation consultation. And so, do you have the skills? And I'm going to say right now, some of you may be like halfway there, some of you may be at the very beginning. Don't be afraid, though. It is just really understanding that, yes, there is a level of competency necessary. We talk about skills, we talk about the touching, and we talk about all those certain things. And sometimes, if we are not competent, we can cause harm. And that is what we really want to minimize and prevent as lactation consultants. Culturally appropriate and credible. I think of culturally appropriate as not really synonymous with culturally competent, because we hear that word. If you've ever been in healthcare, you will hear the word competent. And I'm just of the thought process that you can't really be competent in someone else's culture, but you can deliver care that is culturally appropriate. And when you deliver care that is culturally appropriate, usually, most times, you are deemed as someone that is credible. That means someone that, okay, I can listen to this person. So, we just really need to be clear about how we use language, particularly now we're in this day and age where language, we are understanding more and more how critical language is to everyday life and what we do. So culturally appropriate is a little bit more fitting. And it really starts with, delivering care with cultural humility, really meaning reflecting inside, taking that look of, let me do a self-reflection and self-critique whereby I'm really learning about me and learning about my own culture before I even attempt to really take a deep dive into someone else's. And so this is really a lifelong process, and it is an examination of who we are individually. You know what? Before I move on to that, I do want to say this about culturally appropriate. There are some times when we think we're being culturally appropriate, and I learned this actually in my other discipline, where there is a tendency to say things like X, Y, and Z. When I say X, Y, and Z, I'm talking about cultures. They have a tendency to do this, or they have a. That's really not really culturally appropriate. Because when we think about, I've even heard, oh, this culture don't breastfeed in the first week or so, right? Um, you want to avoid saying things like that. You want to avoid generally talking about people in groups of terms like that, because simply put that there are subcultures within cultures, and so that's just part of that cultural humility, is not feeding into stereotypes. And so I do wanted to add that, is just not making assumptions about what someone will do or won't do based on their culture. So I just needed to not forget that little tidbit that I usually discuss when I'm talking about these topics, right? All right, so being credible means that you really look at, if someone is asking you something, do you just try to go off of your own experience? Because a lot of times we do that, particularly in lactation and breastfeeding. We try to say, oh, when I did this, and it's like, that may not be evidence. So the best thing to do is, if you are presented with a situation or a question, to be credible means that you take a step back and say, you know what, let me get back to you on that. I really don't have the answer, but I know where to get it, right? Moving forward to being a policy advisor and creator, yes, lactation consultants, we are involved in policy. We are involved in policy directly sometimes and indirectly. And what I mean directly is that we are sitting at the table creating policies, hopefully that don't cause unintended harmful consequences. So again, bringing that language piece into policy creation. We are also indirectly involved in policy, is because we're all stakeholders. We're all stakeholders. You know, believe it or not, every single policy that is made, when it comes to human, it impacts us all. And so we are really sitting there, you know, giving our input, giving our lived experiences with certain topics and certain policies. And so, you know, there are some people, you are already coming into this space. You may have a strong history of policy. You may even work in policy already. I would say, okay, great, because you know we need you. But don't be alarmed that if you don't have that experience, that you just understand that you are meant to be at the table. You are meant to be listening and informing how policies are created, and then also then going forth to advocate for those policies. So you know, when we're talking about advocate, it's just being publicly supportive of either a policy, a cause, or something like that. So just making sure that all of the things that makes an IBCLC is not just how many clinical hours you got, your knowledge base, is also translation of certain critical things that we do that often don't get pointed out. It's, you find out, like, you know, you like, oh, I'm supposed to write this legislator, or I'm supposed to do this, or I'm supposed to do that. Yes, we are advocates. You know, particularly in the certain geographical areas, the infant feeding climate has, you know, can sometimes be challenging. I'll use that word. Yes, challenging. And so I'm here to just give you the real and say, hey, listen, we're all advocates. We are advocating for families and what they choose to do, and looking at policies and saying, well, this policy is good, but it really doesn't center these families here who have these conditions that this policy hasn't considered, right? And so that's why they go hand in hand. And again, that's why it's important that we understand that we're advocating, we're on the front lines for families being their voices, because it is crucial to really helping families achieve their goals when it comes to infant feeding. There are problem solvers and there are researchers, and you can consider this mutually the same. But I'm going to talk about how they may be a little different. Being a problem solver is about 90% of what we do. Really, each family has their own set of concerns. So, for example, the concern might be latch. But again, each family has their own set of concerns because why is it a latch issue? Is it because of the lactating parent, or is it because of the baby, or is it because of both, right? So it's 90% of what we do. So when you're called for support, it is usually in request to some type of problem or issue that a family is having with breastfeeding or chest feeding. So be mindful about framing lactation concerns as this one size fits all framework, because we know we really do. Most of us, I think hopefully I can generalize and say we've been in situations where we know one size never fits all. And so we really should be really problem solving from this individualization lens that can really basically let the family know we see you and I'm trying to work this out with you. And you're sharing the concerns. Researcher, now that can be somewhat considered the same. However, there are lactation consultants that are academic researchers that do research. The field of lactation is so in need of, these actual research studies that can continue to improve and inform our practice. And so, if you've already have a huge researcher background, that's great. You can carry out that academic or scientific research for us using those methods that come along with it. But you can also be someone who discover or verify information, and that's all of us. That's all of us. What makes an IBCLC? All right, so I'm going to preface this as saying that IBCLCs, we can manage uncomplicated lactation concerns. And there are a lot of other credentials that can really handle uncomplicated. What sets the IBCLC apart is really being able to handle complicated lactation problems. So in saying that, we talk about acuity of the lactation issue. And when you think about acuity, that is a framework that is actually developed by another lactation consultant in Oklahoma. And we're talking about level 1, level 2, level 3. I'm not going to go through all those levels. However, I will say that a level 2 and a level 3, theoretically, an IBCLC should be able to manage that level of lactation care, which means you have to be skilled to really handle that level. And if you're thinking about in terms of, Sekeita, what are you talking about these levels? What does that mean? That means if you had someone that was in the ICU who was intubated, which means they're on a breathing machine, and their preference prior to, having that condition or being in the ICU was that they wanted to provide human milk, how would you manage that? Would you be able to look at the medications? Would you be able to look at the person as a whole? Would you be able to gather all of the information? And would you be able to teach those that are delivering the care how necessary and how important it is to really carry out this person's wishes? And that is a delicacy. So that is what I mean by high level. Now, that is kind of like, I've had some working in a hospital. Yes, I've had a few people, but that is not just you don't get scared out there. So that's not just a common everyday thing that occurs. But if you were presented with that, would you have the resources and the skill and the wherewithal and the knowledge and the attitudes to be able to manage the client? So when I say high level lactation care, that's similar. That's really what I'm talking about. And you can take a deeper dive if you want to by looking at the acuity the acuity framework, and it's, out there. You can, Google it if you want to, but, it's very important that we understand that we are delivering care. We're not just going to rooms latching. We're just going to each room just latching babies. That's really not what we do. We do comprehensive health histories. We do comprehensive assessments, and our assessments involve the entire family unit, not just the mom and the baby. So I could go on and on about what I mean about skilled high-level lactation care. I'm gonna leave it there, and hopefully you'll get the point. Essential and timely. If we didn't learn anything else during the pandemic, I think we heard the word essential so many times. Those of us who continue to see clients, we really figured out that we were essential, and that often we weren't even considered essential. And I'm going to clarify what I mean by that. What I mean is that, seeing lactation clients when the pandemic hit, we really were like not able to purchase gloves. We weren't able to purchase the types of masks that we need. Those of us that were still going out and making these home visits because we weren't considered essential. I'm here to tell you that we are. And that became a buzzword, but I definitely found out that we are essentials because babies were still being born, people were still having children, and they were still experiencing difficulties, and more times more difficulties than prior to the pandemic, because one thing that happened is lactation consultants were often either let go, or some of the lactation consultants were put into rotation as nurses. And so really and truly, during a pandemic, it is essential that we promote and protect the ability to provide human milk. Critically important. So not just thinking about from like, oh, the bonding, but it's really at that point, it became public health and prevention. And it's always public health and prevention. But at that time, it also became food security for some families. So yes, we are essential. And it's important that we show up in a timely manner when people need us. In all honesty, when certain places closed their doors, it was hard for families. So, when you become a lactation consultant, if you are unable to really commit to that timely, skilled access, then have someone else that you can work alongside with, that if you can't do it, they can do it. Because truly, timeliness is of the essence when we're talking about feeding issues with babies and with maternal and lactating people. So I just want to be clear that we do have telehealth. Yes, telehealth is great. Telehealth works in certain types of lactation consults. However, telehealth does not work sometimes in, for example, rural areas where the bandwidth may not be as well as in certain other areas. And so just want to be clear that if you don't show up in a timely manner, that can truly break a family's experience with food security and with ensuring that their baby received the best start in life. So I just want to leave you with that. And then these last few points about becoming a trusted collaborative care partner. I love the phrase collaborative care partner, because what it assumes is that you are collaborating with your client, which means you're not the center, you're not the decision maker, you're simply collaborating. Remember, it is the families and their partners. It is their goals, their fears, their wishes, their barriers that takes precedence over your goals for them. So, excuse me. So what I'm saying is, yes, we all know the recommendations to provide human milk exclusively is for 6 months, at least 6 months, right? We all know those things. But it's also important that we still honor, what the family is going through. We still honor the recommendations and we still talk about them, but we do have to understand that we are collaborating, we are in partnership and agreement, that when someone seeks our care, that we make sure that we approach it in a manner where we don't overstep our boundaries, where we say, okay, you know what? In all honesty, this is what, the recommendations say, but this is what you are deciding to do. And you're trusted to really say, I see you as a person and we're in this together. I'm not the expert on what your set of circumstances are. You are the expert. And that's truly how you become trusted. When you go into clinical situations and you walk in the room and you walk in like, yep, head up, like, I'm the expert. I know all about this. I've been doing this for 15 years. Let me tell you how it's going to go. Okay, yep. And you latching. This is how you do. Okay, and then you leave, right? You will lose trust. And if you lose trust as an IBCLC, because this has happened, then other IBCLCs lose trust. When you walk into a room and someone asks for latch assistance and you just begin touching without even asking, you just say, I'm the lactation consultant. You don't say, oh, I'm Sekeita, I'm here to help you. You just go in. That's another way to lose trust. And so remember, you're collaborating. You're the collaborative person in this relationship. And the more you frame each activity with your clients, they will become to trust you more, and they will feel like you see me, you understand my barriers, you understand my goals, you understand what I'm trying to achieve here, and you're here to assist with that. So everything that I've talked about prior to now is could be considered person-centered care. I've talked about culture. I've talked about the type of care. I've talked about communication and collaboration. And patient-centered care is defined by the Institute of Medicine as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decisions. So in saying that, I think I can wrap it up safely to say, don't allow person-centered care to become a buzzword for you. Really think about your practice with the intentionality of this framework, and really not only the intentionality, but the actions that it takes to go into this type of framework. And so with that being said, I am going to leave you with a couple more questions, because I think it's so important that if you're in this space today, that you understand what to look for next as Angela begins to speak. All right, so additional questions to ask yourself. What pathway? So Angela's going to talk about the pathways. If, and I recognize and I honor that the question box is there, but allow Angela to get through the pathways, and then you'll be able to understand which pathway. And then if you have some questions, then, chat away, type away, right? Also, though, think about, where do you plan to work? What does the market look like for you? The local market, is your area saturated with lactation consultants? I'm going to tell you it's not. But really, where is lactation consultants working? How much lactation consultants make in your area? Also ask yourself, how does this fit into my lifestyle? And when I say this, I mean the start of your training and your education all the way through becoming a lactation consultant or studying for the exam, becoming a lactation consultant, and then your work thereafter. So these are all questions that I would say, write these things down, reflect on them, and see truly if this is for you. And if this is something you want to do, go for it all out. Angela, take it away.
Yes, go for it. I love that. Perfect. Thanks, Sekeita. Okay, so here's the roadmap to becoming an IBCLC. It can feel a little complicated at first, but I'm going to break it down and give you this roadmap. We're going to touch on this later in today's presentation, but as you're listening, know that you don't have to go out and find each one of these things. LER has ways to help with each step of this process. First thing you need to do is choose a pathway. We're going to come back to this in just a minute. Now, each pathway has 3 components. The first one is education. The second is clinical hours. And the third is getting ready for the exam. Okay, so first, education. So there are 2 different types of education that you will need. The first are health science education requirements. So this is the typical education for healthcare providers. There are 8 post-secondary or university level courses and 6 general education subjects. You can find a full list for each of these 14 subjects on the IBCLC Commission's website. You can search for it online, or you can find the link in your resource document. Take a look on the GoToWebinar interface, and it's the handouts section. The 8 university level courses are, and you don't need to write these down now, but they are biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, and finally, sociology or cultural sensitivity or cultural anthropology. They can be online or in person, as long as the institution is accredited to provide the learning. If you took any of these courses during your college career, they count, even if it was 20 years ago. LER has created an amazing partnership with Walden University to provide the basic college courses. Walden is online, and they have chosen courses which will best fit the Commission's requirements. And LER students can receive a 25% discount on the incredibly discounted rate from Walden. Now, the 6 general education subjects are medical documentation, medical terminology, occupational safety and security for health professionals, professional ethics for health professionals, universal safety precautions, and infection control, and basic life support. Now, 5 of the 6 general education courses can be taken through LER. The only one you're going to need to search for is basic life support. In many countries, there is an in-person skills check for this training. I've heard some organizations will provide this training completely online, including the skills check, but it's important to check with your local resources. The guide, which provides general descriptions for the typical courses in the subject areas, this guide that you can find on the Commission's website. Now, do keep in mind that in the guide, you're going to notice that the descriptions for different courses may be a bit broad or may not exactly fit the description which you have when you took a course in, let's say, sociology. So the names may be a little broader. If it doesn't exactly fit the way that your accredited educational institution describes a course in sociology, don't worry about it. It's okay. IBLCE is an international organization. Therefore, the broad terms are utilized because a description of what a course in sociology may cover in, let's say, Botswana may be different than those which are covered in India. And so there is no one universal description for that course. Therefore, the IBCLC Commission actually has broader terms. And so as long as it fits and it's close enough, chances are it will work. Now, why are these 14 courses required? Remember that the IBCLC is a standalone credential, meaning you don't need another certification, degree, or license to practice as an IBCLC. Once you pass the exam, you will be an allied health professional. The courses will help you to be prepared for your career as well as to help you pass the exam. Now, the second thing you need is lactation-specific education. This is where LER has you covered. The education should be comprehensive and cover the detailed content outline. The Commission requires at least 90 hours of lactation education and 5 hours on communication skills. Our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. The third component is lactation-specific clinical experience. This can be in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding and lactating families. Also, it includes lactation assistance to pregnant and breastfeeding clients and lactation education to families and/or professionals. Now, these hours are to be obtained within the 5 years immediately prior to applying for the exam. Now, how many clinical hours do you need? That depends on your pathway. Pathway 1 is for health professionals and those who provide breastfeeding support through an IBCLC recognized breastfeeding support counselor organization. Healthcare professionals, according to IBCLC, includes physicians, nurses, midwives, dietitians, physical therapists or physiotherapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as Lactation Education Resources, La Leche League International, or the Australian Breastfeeding Association. Now, Pathway 2 applicants must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. Their education has both didactic and clinical components, and they require 300 clinically supervised hours working with families. Pathway 3 is a structured mentorship program between an IBCLC and the applicant. Now, the requirement from IBCLC is that the IBCLCs who support you in Pathway 3 must be in good standing with IBCLC. Now, those who choose this pathway must have their program pre-approved by IBCLC prior to beginning their clinical hours. So just one quick note, for those of you who have breastfed or chest fed or provided human milk for your child, the hours you spent nursing, pumping, and helping your friends sadly doesn't count towards your clinical hours. Now, while 500 or 1,000 hours may seem like a lot, there's a really good reason why. Each candidate needs to have the clinical experience that Sekeita was alluding to so they can provide competent care as an IBCLC. If it's any consolation, the number of hours required used to be a lot more. I've known IBCLCs who needed anywhere from 2,500 to 8,000 clinical hours to sit the IBCLC exam. So things have changed for the better. Candidates who are applying for the IBCLC exam through Pathway 1 need at least 1,000 hours. For the candidate who's also a healthcare provider, the hours can be done in a hospital, birth center, clinic, lactation care clinic or practice, or independent practice as a licensed or registered healthcare professional in a non-healthcare setting. For breastfeeding support counselors from an IBCLC recognized organization, their hours can be earned in person or online. The location and type of support depends on the criteria provided by the recognized organization. These hours need to be counted on an hour-by-hour basis. Now, 2 important points about clinical hours through Pathway 1. It is important for you to document the hours as you accrue them. Be very detailed in case IBCLC chooses to audit your application to take the exam. They may want to see documentation, such as a spreadsheet or another document where you documented your hours. The 1,000 hours do not need to be directly supervised. Now, note that LER has a program for those of you who are not already affiliated with a breastfeeding support organization. The LER Hours program offers you a way to gather those 1,000 hours in your community. Now, Pathway 3 requires 500 hours of clinical experience. It's best done in a busy practice where you can work with many breastfeeding, chest feeding people, and those providing human milk for their babies each day, such as a hospital or clinic setting. The hours which count towards the 500 hours are those which when you're actually working directly with families. So there are observation hours which you're going to need before you begin providing that care, and those observation hours don't count. Remember that clinical experience is graduated. That is, it starts with observation, then doing the tasks under supervision, then completing the tasks independently with the IBCLC close by to ask questions and discuss the situation. LER has an internship program with many sites around the United States. Reach out to support@lactationtraining.com and we can connect you with our clinical internship director, Amy, to determine if we have a site in your area. If not, we can give you suggestions on how you can work with your local hospital to facilitate an internship site. Now, one thing that Amy wanted me to mention in this webinar is that you can't start to count your hours towards the internship requirement until both you and the IBCLC are comfortable with you working independently. Most interns will spend approximately 75 hours in orientation before you can begin to accrue your hours towards the 500. Or you can take a look at people in your community to find a willing internship site or mentors. Now, you may need to reach out to many people to find someone with the time, experience, and capacity to agree to be your mentor. It's important to find a good fit. Talk to others who've been through Pathway 3 to find successful strategies with finding that good fit. Now, while this pathway has a few additional steps, some people will ask, well, is it really worth it? It is. Why? Well, IBCLC reports that students who come through Pathway 3 seem to score best on the exam. I believe it's that mentorship piece, which is the key component. Learning from an experienced clinician is well worth the extra effort involved at the beginning of this pathway. Now, a lot of people are asking whether or not they can accrue clinical hours via telehealth during the pandemic. The quick answer is yes. The longer answer is paraphrased from IBCLC documents. They will allow the use of technology if certain parameters are met. You'll need to pay special attention to the privacy rules and the Code of Professional Conduct and the clinical competencies for IBCLCs. So do keep an eye on their guidance as to whether or not you can count your hours in this way through Pathway 3. At LER, we have two ways to gather your lactation-specific education. One is LCTP, which is the Lactation Consultant Training Program, which is the full 95 hours front to back. The other is either core or bridge. They are designed to meet your education needs depending on your background and previous lactation training. So first, our comprehensive course, which is the Lactation Consultant Training Program. It's a 90+ hour course which is eligible for CERPS, CME, and nursing contact hours. It's intended for those who do not have any lactation education and know they want to become an IBCLC. We have more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including Sekeita and me. Our classes are economical. You can view them on a variety of devices, such as your computer, tablet, or phone. They are optimized for a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We update our course information with the latest peer-reviewed evidence on a regular schedule, but we'll update sooner as new evidence emerges. Have a question for the instructor? You can send an email to our support forum, and we have IBCLCs available to answer your questions. Want to discuss a concept with your fellow students? We're discussing innovative ways for people to connect, so stay tuned for more information. Upon the completion of the 95-hour course, you are eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you are a Certified Breastfeeding Specialist. This is to recognize you for the level of education you have attained. With this certification, you can begin to collect your clinical hours towards the IBCLC exam. Now, if you're unsure where to start, or you already have some lactation-specific education hours, then we have our core or bridge program to meet your needs. They have the same advantages as the LCTP course. Our initial course is called core because it will provide you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It's a 52-hour+ course, which is all online. It covers the basics such as anatomy and physiology of lactation, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is the Certified Breastfeeding Specialist exam. Now, the bridge course is ideal for people who have the basic lactation education components and need an extra 45 hours to qualify for the IBCLC exam. Topics in our bridge course include legal and ethical concerns for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. If you're not sure where to start, well, if you're new to the profession, I would suggest the core course. Get your feet wet and see if becoming an IBCLC fits. Now, I know these requirements seem like a lot. LER is here for you every step of the way. If you have questions about any of the pathways that don't get answered here today, please be sure to reach out to our friendly customer support department. Many of our team of customer support folks are IBCLCs, and they know the process inside and out. LER has 3 ways for you to earn your education, depending on your goals and where you are right now in the process. If you have questions about what would be right for you, again, our customer support team is here to help. If you're not a healthcare professional working directly with parents and babies, getting those hours can feel like a challenge. Remember that we have 2 programs, one for Pathway 1 and one for Pathway 3 students. And when you're ready to sit for the exam, LER has you covered there as well. We offer 2 versions of our very popular exam prep. Both use the LER QBank system, which is a comprehensive system including practice exams, photo flashcards, anatomy flashcards, a study schedule, and more. For those who take our 95-hour course, we include a discount to our exam prep course as well. Our 90-hour course, as well as core and bridge, are available in Spanish. Capacitación en Lactancia is our website, which provides the same high-quality education found on LER in Spanish. At LER, we believe that access to high-quality lactation education should not be limited to those who live in countries with high incomes. We recognize that in many parts of the world, the relative purchasing power of a local currency may make the cost of lactation education inaccessible. As part of LER's commitment to increasing access to lactation training worldwide, our pricing is adjusted according to the student's country of residence. In alignment with our continued commitment to diversity, LER is proud to announce our Rising Tide Lactation Equity Scholarship Program, designed to increase the number of Black and Latinx and Hispanic IBCLCs in the United States. We recognize that one of the greatest obstacles to entry into the field is access, specifically demonstrated by financial barriers. LER will remove that barrier for Rising Tide Scholarship awardees. We alternate these scholarships each year. In 2024, it will be the Rising Tide Lactation Equity Scholarship. You can find out more on our website, lactationtraining.com/Rising Tide. Our team is here to help you now and in the future. Tech support is open 7 days a week. Get your questions answered by content experts in the field, and we can provide ongoing support for the next steps in your lactation career. For example, we had a student who reached out to one of us who had a question about the development of a policy in their facility, in their hospital, and we were able to connect them with the IBCLC who could answer their questions and provide them with support. Another student had a question about how to deal with a family in a specific situation. And again, one member of our team who had experience in that area was able to provide them with a few resources as well as a little bit of a framework on how they could address the situation. So we are here to support you now and in the future. Thank you very much for your time today. Okay, Sekeita, here we go. What questions do we have from everybody?
Yes, thank you, Angela. I'm going to start off with the first question, and I'm going to pass this question to you, Angela.
Okay.
Do you think that the IBCLC will eventually become a license and not a certificate?
So the IBCLC is a credential, and licensure is a US topic, and it is a state-by-state endeavor. Currently, there are 4 states in the US which do have provisions for licensure, but licensure is something which actually has to go through each individual state's legislature. And so I know that there are efforts all around the country for the license piece. IBLCE will never require that license because IBLCE is an international organization. And so it just sort of depends on each state whether or not that licensure piece will actually go through This has been a topic of conversation probably for the past 10 years, if not longer, maybe at the beginning of the whole profession, which was, 40 years ago. And so indeed, it is something which has been discussed. However, at this moment, it's not something which is required by all the states in the United States. Does that answer, you think, Sekeita?
I think so. And I'm going to move to the next question.
Thanks.
This one says, I am a family practice PA and wanting to add lactation services to my area where there's very few IBCLCs. I too am struggling where to gain enough hours. And I'll start by saying yes, affirming that that is an issue probably globally. When I asked about is the area saturated, and I said probably not, right? That is an issue that a lot of people are struggling with, particularly now after the pandemic. There's been lots of different protocols put in places. However, what I will say is to really network in your area. So if you have a breastfeeding coalition, I know in Pennsylvania, particularly the AAP really does these, they have a nice group of networking where they do meetings every month regarding human feeding. And so I would say start to really integrate into the community and really learn who's who and build relationships so that you can figure out where you would be able to achieve hours or where you may be able to achieve these hours. Sometimes you'd be surprised about where you can get the hours, particularly, for example, if you are doing Pathway 1, you may be able to volunteer at some places to do some lactation education or some classes. So I would say really integrate into the community, any local breastfeeding coalitions, that sort of stuff. Angela, do you have anything else to add to that?
No, I think that networking piece is something which is really important, and just listen to folks, right? Listen to the families, find out where they're finding care, find out where they're going for the care, and that may help. And there's not like one organization or a catch-all. Some organizations who may offer lactation support, they may be at capacity or over capacity. And so finding those innovative ways to network and to be able to offer support is something which can really can enhance the services that you can provide.
Yeah. Thanks, Angela. There's another question. If the 1,000 hours are private practice, how will I prove it? Angela talked about a spreadsheet, talked about being audited. So you could essentially use a spreadsheet. You don't want to keep names and like personal information, but certainly keep the hours, the type of situation that it was, maybe even some notes of resolution or follow-up. You just want to keep notes about it. Part of it being almost like an honor system. And that's when I talked about, I didn't bring in the word integrity, but in order to be competent, you have had to at least had these experiences. And even when you go to sit for the exam is a very practice-oriented exam. So if you really haven't done the amount of hours, you will have trouble with the exam. And so with all that being said, a spreadsheet of keeping your own hours, keeping track of it, keeping fidelity to what 1,000 hours of practice looks like and is. And, I think that's all I can sum up and say. Angela, do you want to add to something?
No, I think that's it. I think that's perfect. I mean, in other words, the more experience you have, the better you'll do on the exam and the better care you'll provide to your families. And so indeed, I know that it seems like a lot of hours, but it's that time and that experience that you gather. And that's where you find your resources. That's where you find the additional folks to support your journey. And, one thing, Sekeita and I both, I know, mentor a lot of people. And I like my mentees. I like my interns. And the reason I like them is because they keep me on my toes. And so then I'm the one who's doing all that research as well. So it's like I'm learning along with them. And even though, you and I have been doing this for a minute, Sekeita, right? I still learn something every single day. Every day I learn something. And so it's important to make sure that you do document your hours. IBCLC has a spreadsheet, but frankly, I think keeping some sort of record yourself is important. And in our hours program, we provide you with a spreadsheet so that you can count your hours, but also we provide you with additional resources so that you can determine sort of where your areas are where you need additional support or need additional education. So it can be very instructive.
When you're looking for mentors, I just want to add this tip.
Please.
You mentioned that make sure you build relationship. Make sure you really, to become a mentor, there are hours. Well, for those of us who really enjoy teaching, some of us can spend hours of really teaching or helping someone understand a concept or individualizing a care plan for a complicated case that they were like, whoa, I can't do this. And really, as the mentor, telling them, yes, you can. Think about this, think about that. Think about the flip side of what that mentor is bringing into that relationship, into their experience. They're giving of themselves, sometimes really selflessly. And so if you're really going to go into that, really develop a really trustworthy relationship, one that is really we've had some mentors. I've had a mentor. I can't say we had to let go because of integrity issues. And so really, really holding that relationship. If you really want to become an IBCLC, really and truly recognizing that when we take on when we take on mentees, that's saying, yep, I'm an IBCLC, I'm vouching, I'm signing off my name. And so what does that mean? Does that mean you're going to get the clinical hours? In my mind, yeah, my mentees are going to get their hours, but really leaning into a relationship of humility, because it does take a lot to mentor, and some of us are mentoring multiple people at one time. So
it's true. It's true. I want to answer a question that Wendy already answered.
Yes.
But someone said, does this mean pathway 3 is the only option for someone without a medical degree? So the reason why it's Sekeita and I who do this is because I work exclusively as an IBCLC. I started in peer support, and then I became an IBCLC. Sekeita came as a different pathway. I shouldn't use the word pathway because we both went through pathway 1. She was a healthcare provider and I was someone who worked with a lactation support professional. What, Sekeita, did I get something wrong?
I did pathway 3. Remember, I had a mentor.
Oh, that's right. You did the mentor. Yeah, you did pathway 3, but you were eligible for pathway 1 or 3, right?
Pathway 1.
And I could have done pathway 1 or 3. Yes.
Yeah. I was a nurse working already in maternal child, but I chose the mentorship route because of the richness of the experience and truly understanding that, in order to do pathway 1, I could do phone calls, I could do this, but I wanted to be in the work. I wanted to be challenged and immersed in the work in a way that I knew that when I was going to fly solo, I was going to be solo.
That's exactly right.
Yeah.
And another question that a few people have asked has to do with the college courses. You need the same college courses for all 3 pathways. For those who are healthcare professionals recognized by IBCLC, you've got it done. They're going to assume that you've got it done. For those who come from the community support or breastfeeding support organization, you just have to make sure that you have those hours, those college courses. That's it. And this program that we've created with Walden is absolutely phenomenal because the price they have agreed to provide all 8 college courses for less than 1 college course. Like if you were to go to your community college or some other university, it's the same price as 1 course. They will offer all 8. And so you can find out more information on our website, but we're happy to answer questions about that. But if you took those courses 8 years ago, 10 years ago, 20 years ago, they count. So.
Okay. All right, Angela, I'm going to throw this question to you because you have such a global lens about things, and you are a world traveler. This question says, I am a midwife working in Turkey since 2018. I received an official lactation consultant training and certificate from Ministry of Health in Turkey in 2020. Since then, I'm working online in my own company as a lactation consultant. is it possible to use my previous working experience as, I think this says 1,000 clinical hours. What kind of pathway should I choose? Can you please enlighten me on this topic?
So I would say, first, congratulations for getting that additional training. And indeed, we do need more lactation consultants in Turkey. You can count the hours. You have to have the 1,000 hours in the 5 years immediately preceding taking the exam. And so I would recommend that you count the hours after your training. And I think that while the training may have been a high quality training, you need to cover every section of the detailed content outline in your lactation didactic education. And so it's important that you ensure that the training that you have is comprehensive. A lot of times trainings I have found from various governmental organizations and international organizations is the basic. It's usually based on the WHO 40-hour training. And the IBCLC training, though, is something which is a bit more comprehensive. So just make sure that, for example, some of the more complex or outside of the box areas of the detailed content outline are covered. And I actually have the detailed content outline sitting right here because I keep it close by. And I'm thinking things, for example, such as, breastfeeding in emergencies, the Baby Friendly Hospital Initiative, applying evidence-based practice, let's see, the WHO code, advocacy. There was something else I thought of. That's why I grabbed this here. Weaning, supporting a family who continue to breastfeed or lactate and provide human milk for their baby beyond the first few weeks or first few months, because an IBCLC supports folks from preconception through to weaning, and weaning can be several years in certain cultures. Also, cultural humility is something, and so it's important to get that sort of wide variety, and finding something which can provide access to training around all of the detailed content outline would be helpful. Do you think I answered the question, Sekeita?
I think so. Thank you for that, Angela.
Absolutely.
So this question says, hi, do you need to be up to date on all vaccines? This is going to depend on your location, where you work at across the world. It also depends on, in some hospital systems here in the US, if you plan to work in a hospital, there are some systems that have mandated vaccines. And so it depends on the context of where you will be working. And so if, think about that, wherever you're going to be working, check into it in your local area.
That sounds good. Yeah. I also think that I also see another question here, and someone who has taken a bunch of breastfeeding education courses through an organization that provides doula support, as well as a WIC program, a Women, Infant, and Children's program here in the US. And so just be advised that, again, both of those curricula are focused on, depending on the doula organization, they may be focused on those first few days and first few weeks and some of the basics. And so make sure that you're getting that comprehensive education, mostly so that you can, even if you have more clinical or more lactation education specific hours than you need to cover the entire detailed content outline. If I had 95 hours on, the only on baby friendly around the hospital stay, that wouldn't necessarily train me well enough to be an IBCLC to provide full spectrum care and to be able to handle all the acuity levels that Sekeita referenced earlier in this talk. So make sure that you have something which is comprehensive.
Awesome, thank you. Angela, when is the next application period for the Rising Tide Scholarship? And is it only applicable for Pathway 1?
So the Rising Tide Scholarship is for either Pathway 1 or Pathway 3. So we can support you in either pathway. It will be later this year in 2024. So do keep an eye on our social media for when the application period is open. I will say that both our Rising Tide as well as our Juntos Triunfamos scholarships are very competitive. And so please do, we welcome the application and know that they are highly competitive, but don't shirk it, right? Apply, please apply. We have I really enjoy, we just, finished up and announced the Juntos Triunfamos, and it was just really something inspiring to see all the work that people are doing all around the country. So keep an eye on our social media as well as in our newsletter.
Thank you for that. This question for Pathway 1, I am an RN. I currently work as a float RN where I work in L&D, antepartum, and postpartum. Do my hours in each of these departments apply towards 1,000 hours of clinical experience providing lactation education? And I'm going to answer that by saying no, not every single hour. It is the time that you spend providing lactation education and support. So if you think about it, I don't know if you work 12-hour shifts or if you work 8-hour shifts or even 4-hour shifts. I mean, there's a lot of types of shifts around here. But in that course of time, if you've provided lactation support, for example, maybe 2 hours out of the day, then you can count those hours that you were actually providing the care and support or the education regarding breastfeeding. I hope that helps. Angela, you want to add anything to that?
No, I think that's good. I think that's good. We're going a little long today, but these are some phenomenal questions. So we're
I
going to keep going.
know.
If you all are still sitting here, we're going to keep going here. Someone says that they are in the UAE and they're curious if we can provide them with a certificate to get them to be able to practice in their hospital. So that really is a relationship building that needs to happen between you and the facility. In other words, you letting them know what services you can provide as a certified breastfeeding specialist, and hopefully soon enough as an IBCLC. So you're going to need to negotiate that with the facility and let them know. That would be pathway 3 if you wanted the mentorship program. If you could also do a pathway 1 in the hospital, but again, you would need to be the one who would negotiate with the facility to let them know what services you can provide. Someone else here has just completed a 52-hour course from someone else, and that they're asking whether or not they need to have the bridge program in order to complete to the 95. Yes. But then they say, and then 300 supervised clinical hours. So the 300 is pathway 2. We're really not talking about pathway 2 today. We're only talking about pathway 1, which is the 1,000 hours if you're a healthcare professional or with a breastfeeding support organization, or pathway 3 if you're in a mentorship program. And so that's something, and the previous training that this person has is not either a healthcare profession, nor is it a breastfeeding support organization. And so you would need to either go pathway 1 or pathway 3 and take a look at the requirements just a bit more.
Thanks, Angela. I think it's clear to understand pathway 2 is specifically talking about those really colleges and organizations who have that actual program.
And there's only 8 of them in the world. Yeah. So that's why we don't cover it in too much detail, because there's only 8, and you'll know because they'll say that they have a degree in, human lactation.
Yeah. The Rising Tide Scholarship is saying that it's closed. Winners will be announced with August 31st. Will another opportunity open up again? Yes, that is saying it's closed from the last time we did the applications. It will open up again in 2024.
Yes, it will. Okay. Think.
Is that it?
Let's see. Can research work count as clinical hours? My research is investigating the role of tongue tie and breastfeeding difficulties, where I'm screening babies for tongue ties and following them up. Research? No. It sounds like though you're providing clinical care. And so the clinical care that you're providing may count, but again, dealing with tethered oral tissues is a very small part of the detailed content outline. And so I would encourage you to make sure that you're also supporting, families through the normal course of breastfeeding and or human milk feeding. So I think that's something which would be important to remember. And it seems that if you're supporting, screening and supporting babies with tethered oral tissues and providing the follow-up, it's important to ensure that you're able to provide that sort of comprehensive care, and as opposed to something which is really specific with tethered oral tissues.
Yeah, someone was questioning whether or not they should be in this space because they are already prepared or they're getting ready to sit the exam. I hope that, the beginning of this portion was helpful for you. We do have a, was it 30 days in county? No, we did
90 days. We did
already.
90 days already,
Yeah,
and we'll do
yep,
30 days soon.
it's coming up, right? Exam prep. So yes, that probably would be more applicable. But there's also a question, Angela, about OHIP, and that's in Canada. But I can wait a minute. I just lost it.
I see
Okay,
it.
you see it? Okay, all righty.
So the thing is you'll have to check with OHIP. So OHIP is the Ontario, the health insurance program in Ontario. So you would need to check with OHIP. I want to say 80% certain, because I recently worked with a certified breastfeeding specialist in Ontario, and they were trying to figure out a way to get OHIP to cover. And so this is familiar territory for me, and I do believe that you need to be an IBCLC. So you would need to actually reach out to OHIP to confirm that, as opposed to the CVS piece.
Question, can I have a mentor supervise my own private practice work via chart reviews for the 500 hours, or does it have to be only their patients? It has to be clinically supervised. So I'm assuming it wouldn't matter whose client it is, but the IBCLC should be supervising that. Chart audits would not work under the premise of the 500 hours of supervised clinical.
Correct.
So.
That's correct. Okay, good. Let's see, WIC peer counselor. Wendy, can you answer that one? Can it, or just pop it into the chat? Somebody's working as a WIC breastfeeding peer counselor. If that is able to be used, that would be helpful.
For those who are asking questions about the exam, if you can join us, or actually that question can be answered in a pre-recorded 90 days in county, I believe on YouTube, right, Angela? We have some of them on our website as well. We've recorded, what to do when you get stuck on exams and that sort of stuff. We have also recorded like the last minute, like, hey, it's almost time. These are things you want to consider. So you could join us on our next webinar discussing these very key, important points about sitting for the exam, or what to do when certain things happen.
Yes, and I am frantically searching for when our 30-day and counting webinar is. I can't, there it is. Oh, that's when, I think it's the 22nd of March is when I think it's happening. So it's a little less than 30 days before the exam, but actually strike that. It's something that I actually need to double check when that 30-day and counting course is. So
okay,
we will get back to you on that one, or do take a look in our portal in order to determine when that is.
Yeah. This question says, as a registered nurse with my BSN, does this mean I've completed all the educational requirements minus clinical hours? Yes, you should have basically, you've completed the education requirements. Even someone with an associate's degree, I believe, would have completed the requirements for the educational piece. So you would need the clinical hours piece, as well as the credits, the lactation, or I'm going to say the lactation education, the 95 hours of lactation education.
Yep. All right, I am.
Somebody is questions today.
I know somebody else is also a different type of certified lactation provider, and they're actually out there supporting people in the community and the hospital that hire them. And so they're curious which pathway. And the thing is that pathway 1 is for healthcare professionals. You already have to be a healthcare professional, and or breastfeeding support organizations. If you're not part of a breastfeeding support organization, it doesn't matter what initials you have, you cannot count your hours through pathway 1. Pathway 3 is a pre-approved mentorship program. You need to find a mentor in order to, and get it approved before you can start to count your hours. And so that's something which is important. IBCLC is pretty, and this is not the Angela rule, right, or the Sekeita rule. This is what IBCLC says that has to be done. And so I'm not going to, we're not going to talk about the fairness of it or why, but gee, I'm doing the same. IBCLC is really myopic in what they suggest. And so it's a matter of, this webinar is to help us to follow those rules. So Okay, good. Somebody's looking for the exam dates, and do take a look at the IBCLC website. For that, you need to apply several months prior to sitting the exam. And so that's something which is important. And I think
I
that
think
one
too,
more.
just because you just said that, Angela, is that when you apply, sometimes be prepared to get audited. Just because you apply, don't necessarily mean. So if you are really considering applying, apply during when the application opens up.
Right.
So that you can be ready for anything or any delays that may occur. I think that would be a helpful tip going forward.
Excellent. Okay, great. I think that's it. I think we got them all. Yay.
I
Wonderful.
love the questions though. I love that the engagement. You might notice like we do this, you guys do this almost every month maybe, but we do this so that we can entertain your questions. And really this audience is ready. I mean, they're like next steps ready. The last time we didn't really get as many questions and we still had a large bunch. And so thank you all for participating. Thank you for asking your questions. Thank you for joining us. I'm going to say, do well, reflect on what this is for you, be great. And Angela, take us out.
Yes, thank you very much for joining us today. If you do have any questions on the slide here, it does say like support@lactationtraining.com. We're happy to answer those questions and to provide you with some guidance. We can point you to certain resources, and if there isn't a resource, we can provide you with what's worked for a lot of other folks, and we will let you know sort of what our parameters are and the why. So happy to support you. We need more IBCLCs out here. Come on, everybody, join us, please.
We need more competent IBCLC.
We need more competent, and I know every single person on this call is exactly that. So please, we need you.
Yes.
Thank you for joining us today. This has been great fun for us, and I hope for you as well.
Thank you. Bye-bye.
Bye, everybody.